Go.
The following presentation on Alexander disease was compiled of information from the United Leukodystrophy Foundation website, the National Organization for Rare Diseases website, and the National Institute of Neurological Disorders and Stroke website. Alexander disease is a rare neurological disorder that is one of a group of neurological conditions known as leukodystrophies, which are defined by abnormalities of white matter of the brain. With Alexander disease specifically, there is a lack of fatty material, known as myelin, mostly in the frontal lobes of the brain, that helps the transmission of nerve impulses. Alexander disease is a progressive disease, which means the condition worsens as time goes on. Alexander disease is not genetically inherited. This means that if parents have one child with Alexander disease, that any other children they may have are very unlikely to have the disease as well. Alexander disease is caused by a defect in the gene called GFAP. GFAP is a type of protein that helps in the structural development of cells. No more than 450 cases of Alexander disease have been reported since its discovery in 1949. Alexander disease is not more prevalent in any particular ethnic group, sex, or areas of the world. The two most common forms of Alexander disease are infantile and juvenile, although there is an adult form that is extremely rare. This presentation will focus on only the infantile and juvenile forms. The infantile form consists of 63% of all cases of Alexander disease, while the juvenile form consists of 24% of all cases. The distinguishing characteristics of the infantile form of Alexander disease are an onset within the first 2 years of life, and survival is from a few weeks to a few years, but usually not beyond 10 years of age. There's a failure to thrive, which means there's a failure to grow and gain weight at the expected rate. Usually there's an abnormally large head, an accumulation of fluid in the brain or between the brain and the skull, seizures, muscle spasms, and progressive psychomotor retardation, which can include difficulties with walking, speech, and mental regression. For the juvenile form of Alexander disease, the distinguishing characteristics are an onset between ages 4 and 10 years of age, with survival into early teens to early 30s. Swallowing and or speech difficulty, impaired coordination, weakness and muscle spasms in the extremities, especially the legs, the mental function slowly declines, and there's a deformity of the spine, usually a hunching forward of the upper part of the spine. Alexander disease can be diagnosed in the following ways: an appearance of clinical symptoms, genetic blood testing, or an MRI of the brain. There is currently no cure for Alexander disease. Individual symptoms are treated, such as antibiotics for infections and prescription medications for seizure control. Prevention of further complications is achieved through regular examinations by a multidisciplinary team, speech and swallowing assessments, physical and occupational therapy when needed, and early recognition of spinal problems. Some organizations and foundations that are great resources for families are the United Leukodystrophy Foundation at www.ulf.org, Hunter's Hope Foundation at www.huntershope.org, and the National Organization for Rare Diseases at www.rarediseases.org. Done.